laging sinasabi yan na cardiovascular disease is the world's biggest killer. So, number one yan na cause of mortality or morbidity. So, number one cause of pagkamatay is mga sakit sa puso. Now, prevalence of COVID-19. So, alam natin sa buong mundo, mga nasa 32 million na ang magkaroon ng COVID. Sa Pilipinas, kahapon nasa 304,000 na ang mga nagkaroon. Dito sa ating local na region, sa Pampanga, although yung data na ito ng September 26, ang confirmed cases dito sa ating dito sa Pampanga is nasa halos magto 2,000 na rin. So 1,800, baka ngayon 1,900 na siguro ito. So kailangan mag-ingat pa rin tayo at huwag magpapamaya. Okay? Dahil nandito pa rin ang pandemic, okay, ang COVID. So, ano ba mga epekto ng COVID-19 sa ating puso? So, alam naman natin na kapag pumasok ang virus, yung SARS-CoV-2 virus kayo, yung COVID-19 na virus, papasok yan through respiratory o yung sa ating paghinga. So, usually, pumapasok yan sa ating hilong, papasok yan at maapektuhan ang ating buong katawan. So, primary, syempre, is sa paghinga, respiratory. Ngunit, yung virus itself, pwede rin siya makaapekto sa ating puso. Yung virus, malalaman natin, ang pwede maging epekto natin, ang pwede maging epekto nito sa ating puso is pwede tayong magkaroon ng hypotension o bumababa ang blood pressure, tachycardia, bumibilis ang pagtibok ng puso, bradycardia, pwede rin bumagal, arrhythmia, ibig sabihin nagiging irregular ang pagtibok ng puso natin, at yung iba bigla na lang mawawala ng malay o yung sudden cardiac arrest or cardiac death. Okay? Now, yung virus mismo, sa mga pag-aaral, kapag ikaw ay may mga significant comorbidities o ibig sabihin meron kang ibang mga sakit, lalo na kung meron kang high blood, diabetes, sakit sa puso, mas mataas ang risk mo na magkaroon ng mga severe infection ng COVID o yung mga pwede kang magkaroon ng severe o critical COVID-19 infection. Kaya kailangan mag-ingat tayo. Okay? Siyempre kapag nagka-infection, yung mga merong sakit sa puso, mababa na yung cardiac reserve nila. Ibig sabihin, yung puso nila, mahina na yon. So kung bibigyan nyo pa ng stress tulad ng infection, mas mahihirapan yung taong yun. Now, itong picture na ito ay hango sa European Society, okay? Cardiology. So, ina-explain lang nito kung ang mga epekto ng SARS-CoV-2 o yung COVID sa ating katawan, kasama na yung sa puso. So, makikita natin yung virus, papasok yan sa ating hininga, tapos mag-i-invade siya sa mga cells. So, typically sa respiratory or pneumocytes na tinatawag sa respiratory cells natin. Now, kapag nakapasok yung virus, magkokosto ng iba't ibang aktibidad sa ating katawan. Pwedeng magkakaroon ng mga pamamaga or inflammation, ma-activate yung mga white blood cell natin o yung mga T-cell. Yung mga yun kasi ang mga lumalaban sa virus. Ngunit, nagre-release ito ng mga iba't ibang chemicals. Nagkokos ng cytokine storm, kaya yung iba mas lumalala. Now, sa puso, yung pamamaga, pwedeng maapektuhan yung mga ugat sa puso o yung mga vessels natin. Pwede rin ho yung virus direktong makadamage sa heart muscle o yung direct myocardial injury. Kaya yung iba nagkakaroon ng tinatawag na myocarditis o yung namamaga yung puso, humihina ang puso o yung heart failure, at yung iba dahil din dito nagkakaroon sila ng arrhythmia or irregularity sa pagtibok ng puso. Now, yung virus itself, dahil nga sa sinabi ko, nagkakaroon ng release ng mga inflammatory cells, prone yung katawan natin, lalo na may mga coronary artery disease na pwede sila magkaroon ng plaque instability. Ibig sabihin, yung mga plaque na nasa ugat nila, pwede ho yun mag-rupture, causing acute coronary syndrome o yung tinatawag nating heart attack. Kaya kapag yung mga, kaya at higher risk yung mga tao mayroong sakit sa puso kapag nahawa sila ng COVID-19. Kaya kailangan mag-ingat. Okay? So alam naman natin yung mga risk, di ba? Mga may edad, hypertensive, diabetic, at yung mga may sakit sa puso. So kailangan mag-ingat po tayo. Now, itong picture na ho ito, makikita natin yung usual course o course ng COVID-19. So iba't ibang simptomas, di ba? Meron tayong mild, moderate, or severe. Now, usually, mga mild na kaso lang, ang typical na simptomas nila is fever, dry cough, yung iba mabilis mapagod, magkakaroon ng sipon, makati ang lalamunan, masakit ang lalamunan, or body pains. So, yung mga yon typically mild lang. So, usually nakikita yon within 14 days ng mahawa ka or nagkaroon ka ng COVID. Now, yung mga nagiging severe o yung mga severe na disease, kailangan babantayan to. Sila usually yung mga merong shortness of breath. Ibig sabihin, konting galaw lang or lakad, hirap na silang huminga. Yung oxygen nila, kapag nagpahinga, bumababa, 94% lang. At bumibilis ang tibok ng puso. Now, usually, itong mga ito, pag ginawa ng mga imaging o pina-x-ray yan or CT scan, nakikita may pneumonia na sila. Now, syempre, yung mga high-risk na tao, yung mga may sakit sa puso, hypertensive, diabetic, hindi sila mag-progress pa to more severe or yung rapid deterioration. So, ito na yung mga nagkakaroon ng critical na COVID. So, in summary, ito ang mga pwedeng epekto sa puso ng COVID-19. Kailangan mag-ingat tayo. Pwede ho magkaroon ng direct myocardial injury. Ibig sabihin, yung virus itself, inaatake mismo yung heart muscle, nagkakaroon ng myocarditis. Systemic inflammation, yung mga pamamaga sa buong katawan, sa mga ugat, sa puso, at iba pang parte ng katawan. Plaque rupture and coronary thrombosis, gaya ng sabi ko, nagkakaroon ng plaque instability. So, prone magkaroon ng heart attack, yung mga meron ng coronary artery disease pag nagka-COVID sila. At syempre, yung mismong mga gamot na binibigay sa mga may COVID-19, meron din yung mga side effect. Okay? Wala naman mga gamot side effect. At kasama na rin ito yung mga imbalance sa mga electrolytes dahil sa inflammation at yung mga gamot na binibigay natin. So, ngayon alam natin na talagang mas mataas ang risk ng mga taong may sakit sa puso or yung mga may edad na mas maging malala ang epekto ng COVID sa kanila. So, anong pwede natin gawin? What we can do to protect ourselves and our heart during this pandemic? Siyempre, unang-una, i-prevent natin mahawa ng sakit. Kailangan i-prevent natin hindi tayo magkaroon ng COVID. Siyempre, para hindi rin tayo makahawa. Okay? So, kailangan magsuot tayo ng tamang face mask kung paano tamang suotin. So, mamaya, pakita natin yung picture kung paano yan. Physical distancing, so importante yon kasi alam naman natin na sa hangin yan. So kung malapit tayo sa ito isa, mas madaling dumapo yung virus sa atin at mas madali natin malangkap. At syempre, kailangan tayong sumunod sa mga local health protocols ng gobyerno. So kailangan magmatigas ang ulo natin. Okay? Now, para sa puso, syempre kailangan huwag natin ititigil yung mga gamot na binibigay ng ating doktor or yung mga cardiologists, lalo na yung mga merong gamot sa blood pressure, cholesterol, sugar, o yung mga merong coronary artery disease. So lahat ng gamot natin, itutuloy natin yan at kailangan pumunta tayo sa ating doktor. At mamaya, yung ating ating lecturer, tuturuan din tayo is paano tumigil sa pagsisigarilyo. Kasi alam naman natin na ang smoking or paninigarilyo, talagang walang maidudulot na mabuti sa katawan. At yung ibang lecturers din po natin, tuturuan tayo ng healthy diet at kung paano ang exercises ang pwede natin gawin kahit nasa bahay tayo para maging physically active tayo. Now, how to wear medical mask safely. So, lumalabas tayo, nakikita natin ang daming tao dyan. Naka-face mask pero hindi naman tama yung pagsuot. Okay? So, yan. Ayon sa Center for Disease Control at WHO, ito mga do's and don'ts sa pagsuot ng face mask. Siyempre, bago tayo magsuot ng mask, kailangan wash your hands before touching the mask. Inspect the mask, tears or holes na dapat walang sira yan. Siyempre, kundi hindi siya effective. Find the top side where the metal place or stiff edge is. Siyempre, dapat hindi baliktad yung pagsuot ng mask natin. So, ensure the colored side faces outwards. Place the metal piece or stiff edge over your nose. So, dito sa ilong, para kasi kailangan fit na fit yan. Okay? Over your mouth, nose, and chin. Yung iba nakikita natin nakamask pero nasa baba. O yung iba yung bibig lang ang sinasarado. So, useless o yun. Walang protection na may bibigay sa atin yun. Adjust the mask to your face without leaving gaps on the sides. Tapos, siyempre, kapag nakasuot na yung mask, as much as possible, wag na nating hahawakan to. Okay? Avoid touching the mask. Kung tatanggalin natin, kung kailangan natin tanggalin, remove the mask from behind the ears. Dun sa parang garter. Okay? Keep the mask away from you and surfaces while removing it. Kasi syempre, yung function ng mask, pinifilter niya. Kung meron ng virus yan o kahit yung mga bacteria, nandun yun sa cloth. So, wag natin hahawakan yun kasi makukuha pa rin natin yung virus kung di tayo mag-iingat. Discard the mask immediately after use. preferably into a closed bin. So kailangan proper disposal din ha. Tapos pagkatapos, wash tayo ng hands properly. So, siyempre, mga don'ts doon is usually yung kabaliktaran ng dapat natin gawin. So, kailangan mag-wear tayo ng mask. Now, yung face shield, additional protection yon. So, nakakabuti din yon. Okay? Pero, kailangan, kahit naka-face shield, yung iba dahil naka-face shield na, hindi na nagmamask. So, hindi ganun yan. Kailangan naka-face mask pa rin tayo. Now, sa social distancing, so, it means putting space between yourself and others. So, makikita natin kahit sa labas, yung iba parang nakakalimutan na nila kung ano yung physical distancing. So, ideally, dapat 6 feet or 2 meters ang pagitan ng isang tao from us. So, kung ano yun, kung average or estimate natin about 2 arms length. So, parang yun, dalawang dampa, di ba? Dalawang dampa. Okay, so 2 feet. Okay, kasi nga, yung virus, nasa hangin. So, kung mas malayo tayo sa isa, yung chances na makuha natin yung virus, mas bumababa. So, kailangan protektahan natin ang ating sarili. Yun ang basic protection ngayong pandemic. Now, para sa puso, paano natin malalaman kung kailangan na natin magpakonsulta? Now, ang mga merong sakit sa puso, meron tayong tinatawag na angina. Okay? So, isa sa mga advocacy ng Philippine Heart Association is yung Angina Awareness Initiative. So, kailangan turuan natin ang mga tao or yung mga pasyente kung paano makarecognize kung ano ba ang angina. So, ito po yun. So, ang angina, ito ay pananakit sa dibdib na maaring maramdaman kapag ang supply ng dugo sa mga kalamnan ng puso ay limitado. Ibig sabihin, kakaroon yan ng mga barabarang ugat, kaya konti yung daloy ng dugo papunta sa puso. So, ilan sa mga pasyente na inatake sa puso ay dati nang nakakaramdam ng pananakit ng angina. So, ibig sabihin, yung iba, meron na yung mga nararamdaman sa dibdib. May chest pain na yan or pamimigat sa puso, pero hindi nagpapakonsulta or binabaliwala. So, kailangan, kapag ma-recognize natin na may angina tayo or yung ating mga mahal sa buhay, kailangan magpakonsulta sa doktor. So, number 1, pananakit sa dibdib na maaring pamimigat or paninikip. Ibig sabihin, yung description ng angina is usually parang may nakadagan sa dibdib. Ayan, titignan natin yung sa picture. Ayan, meron siyang mabigat na weight sa dibdib. Yan ang usual na description ng mga merong angina. So, pakiramdam na may pumipiga o parang may nakadagan sa dibdib. Kung minsan, maaaring kumakalat sa kaliwang braso, leeg, panga o sa likod. So, kung ganito ho ang description ng nararamdaman yung chest pain, baka angina na ho ito. So, mas maganda, patingin ho kayo sa inyong doktor o kumonsulta sa doktor. Ang isa pang simptomas ng angina is karaniwan lamang na nararamdaman ng ilang minuto at ito ay kilala bilang isang atake ng angina. So, ibig sabihin, nawawala kapag nagpahinga. So, ikaw ay pwedeng magkaroon ng stable angina at ito ay maaring malunasan ng gamot. So, pag sinabi hong stable angina, yung chest pain o pamimigat na dibdib na nararamdaman is nawawala kapag nagpahinga. Tapos lumilitaw during stress or physical effort. Ibig sabihin, habang naglalakad ng malayo or mabilis, umakyat ng hagdanan, doon lumilitaw yung pamimigat sa dibdib. Tapos nawawala. Kung ganun ho yung nararamdaman, baka angina na ito or stable angina. Kung ito ay kirot sa dibdib na pwede ring mangyari kahit normal na aktibidad. So, kanina, sinabihin natin kung ano yung stable angina. Meron din tayo tinatawag na unstable angina. Ito naman ay nagkakaroon ng pamimigat sa dibdib kahit hindi naman masyadong gumagawa ng physical effort, iba kahit nakapahinga. Okay? Kung ang sakit ay mas dumadalas na nararamdaman, mas lumalala. Ito ay maaring sintomas na ng unstable angina. Kapag unstable angina ho, mas malubha ho ito. So, kumbaga mas urgent. So, mas kailangan magpatingin na agad sa doktor.
Nakikinig kayo?
Maaari din na hindi maalala ang inyong nararamdaman. So, ang anumang pananakit sa dibdib ay maaaring maging seryoso. Okay? So, kahit na bahagya lang ang pananakit sa dibdib, ito ay huwag ipagbahala. Okay? So, kung hindi ho kayo sigurado kung ano yung nararamdaman nyo, kung sa muscle lang ba ito, o yung iba, baka reflux lang ang iniisip nila, mas mabuti magpakonsulta kayo sa doktor. Okay? Para ma-examine kayo at ma-requestan ng mga additional na test kung kailangan. Okay? So, kung ang pananakit sa dibdib ay mas mahalala na hindi na nalulunasan ng panghinga o gamot, maaari na ito na ay atake sa puso. So spectrum ho yun, stable angina, unstable angina, or heart attack na. So palala ng palala yun. Kaya yung iba, nagsisimula yun sa simpleng chest pain lang, stable angina. Kung meron ng ganun, wag mo baliwala, okay? Wag i-neglect yung nararamdaman. Kailangan pa-konsulta. Lalo na kung kayo ay hypertensive, diabetic, or may history na ng atake sa puso. So, kapag hindi nawawala yung sakit sa dibdib, tapos nahirapan talagang huminga, hindi nawawala sa gamot, sumangguni na sa pinakamalapit na ospital. So, pwede ako yung pumunta dito sa Medical City Clark. Okay? So, ano ba ang mga risk factors sa pagkakaroon ng sakit sa puso? Okay? Actually, ito rin yung mga risk factors ng mga, kung titignan natin, ito rin yung mga may risk na magkaroon ng severe na COVID. So, hindi lang sa sakit sa puso. Yung mga merong ganito, sila din yung magiging lumalala, mga infection ng COVID sa kanila. Kung ikaw ba ay naninigarilyo, mataas ba ang iyong presyon, ang cholesterol mo ba ay kontrolado, ikaw ba ay ang timbang is nasa tama, mataas ba ang iyong blood sugar, o ikaw ba ay alcoholic, umiinom, at ang iyong bang diet is healthy diet. So mamaya tuturuan tayo kung ano yung mga healthy diet, lalo na para sa puso. So lahat ng ito ay may kinalaman o maaring magdulot sa angina. So ito ang mga typical risk factors of having heart disease, okay? Heart disease. So kailangan umiwas tayo sa peligro kasi nga prevention, okay? Still the best medicine, right? Best. So yung iba nagtatanong kung namamana ba ito or kung ano epekto ng mana sa pagkakaroon ng sakit sa puso. So ang mga anak o kamag-anak na mga inatake sa puso or yung mga meron ding angina or yung mga nagkaroon na ng coronary artery disease, lalo na kung bata pa lang, mas mataas ang risk na yung mga anak nila ay magkaroon din ng sakit sa puso. Okay? So, karamihan sa inatake sa puso ay may edad na. So mas common to sa may edad, pero yun din, hindi porke hindi pa yung mga hindi pa may edad, ay hindi na magkakaroon ng sakit sa puso, lalo na kung hindi healthy ang kanilang lifestyle. Mas pangkaraniwan na magkaroon ng angina ang mga lalaki kaysa sa mga babae. Okay? Except pag menopausal, nag-i-equal na yun, pag nasa menopausal age na yung babae. Subalit ang mga kababaihang, menopause na ay may kasing taas ng chance na kagaya na ng lalaki. So, at a certain age, nag-i-equal na ang risk ng lalaki at babae. So, isa pang advocacy ho ng Philippine Heart Association para maalala natin kung paano iwasan ang pagkakaroon ng angina or sakit sa puso is yung 52-100 na tinatawag. Okay? So ito po ay numero na madaling maalala para kung paano tayo mabuhay ng healthy or healthy lifestyle. So ano ba yung 52-100? So yung 5, unang numero is 5 servings of fruits and vegetables per day. So sa ating diet, kailangan lagi tayong merong 5 servings of fruits and vegetables per day. Yung 2, dun sa 52-100 is 2 grams of salt. Sabihin, low salt diet. Okay? So, naririnig natin to sa mga doktor na kapag hypertensive, kailangan bawasan yung mga maalat na kinakain. Or 2 hours of screen time or gadget time. Ibig sabihin, kapag kailangan 2 hours lang tayo nanonood ng TV, kasama na yung pag-Facebook or sa telepono. Kasi syempre, pag nanonood tayo, expected, nakaupo lang tayo, hindi tayo physically active. Kaya kailangan 2 hours lang. Kailangan gumagalaw-galaw tayo, okay? Physically. Kailangan importante yung pagiging physically active. Yung 1 sa 52-100 is 1 hour of exercise per day. Okay? So kahit na naka-lockdown yung iba or naka-quarantine, hindi naman ibig sabihin hindi na tayo pwedeng mag-exercise. Pwede naman ho tayo mag-exercise sa bahay. So mamaya, isa sa ating mga lecturer, tuturuan tayo ng mga pwedeng exercise na gagawin sa bahay. Mga simple exercises lang. Okay? Siyempre, zero smoking. Gaya nga naman sabi ko, walang mabuting na idudulot ang smoking sa katawan. So, kailangan zero. Okay? At ang isa sa huling zero sa 52-100 is zero sugar drinks. So, ito yung mga soft drinks. Alam naman natin, mataas sa asukal yung mga yan. Kaya nga sila masarap. Pero, mas maganda, zero. Kung gusto natin maiwasan ang sakit sa puso. Okay, so I guess, yun lang naman ho ang mga simpleng reminders na gusto namin ihatid sa ating mga viewers kung paano maiwasan at iwasan ang COVID at syempre protektahan ang ating puso sa during this pandemic. So kahit yung mga meron ng sakit sa puso, kailangan tandaan nila na huwag ititigil ang gamot at magpapakonsulta pa rin sila kung kinakailangan. Meron namang yung iba, pwede sila pa rin pakonsulta. Meron tayong mga telemedicine. So, yung iba kasi natatakot na pumunta sa hospital. Pero kung pwede naman sila magtanong kung yung kanilang doctor is may telemedicine. Kasi wag nilang basta-basta ititigil ang mga gamot nila sa puso. So, for me, mga important reminders lang for this is, siyempre, prevent natin ang spread ng COVID-19 by following health protocols. So, wearing properly ng mask, siyempre, social or physical distancing. Tapos, tandaan natin ang theme ng World Heart Day ngayon is use heart to beat heart disease. So, gamitin natin ang ating puso. So, para sa ating society, sa loved ones, at para sa ating sarili. So, kailangan mahalin natin ang ating sarili at ating mga pamilya. So, kailangan alagaan natin ang ating sarili para iwasan ang sakit sa puso at protektahan during this time of pandemic. Siyempre, know when to consult your doctor. So, tinuruan natin kayo ng angina or angina awareness. So, kapag nakakaramdam ho tayo ng angina, pakonsulta ho tayo sa doktor, okay? Para bigyan ng tamang gamot or mga additional na test kung kinakailangan po. Tapos para maiwasan ho ang mga sakit sa puso, kailangan healthy lifestyle. Tandaan ho natin yung mga advocacy ng Philippine Heart Association, yung 50-100. So 5 servings of fruits per day, 2 hours of screen time or 2 grams of salt plum per day, 1 hours of exercise, 0 smoking at 0 sugared beverages. Okay? So I guess ito na ho ang aking huling slide. So kung may katanungan po, i-type nyo lang po.
All right. Thank you so much, Dr. Patawa, for that very informative presentation. So, tulad po ng nasabi ni Doc, sa mga participants po na may question regarding po sa content and presentation na ni-share ni Doc, you may now start typing them down on the chat box. Actually, we received a question earlier when you were still presenting po from Ms. Nika. Good afternoon, Doc. What are the signs for angina for diabetic patients?
Okay. So, ang tanong is, what are the signs of angina? Okay. Now, sa mga diabetic patients, so yung mga na-mention kong senyales or signs or symptoms, yung chest pain, pamimigat sa dibdib, yun din ang typical symptoms ng pasyente. Kaya lang, ang mga diabetic patients, meron silang tinatawag na yung iba, silent ischemia. Ibig sabihin, dahil sa epekto ng diabetes sa ugat, minsan wala silang nararamdaman. Okay? So wala silang chest pain nararamdaman. Kundi ang nararamdaman nila is yung mga atypical angina or atypical symptoms. Yung iba, pwede lang maramdaman is hingal, mabilis lang silang hingalin. Okay? Hindi chest pain. Yung iba naman, epigastric pain, akala hyperacidity lang. So usually mas common sa mga diabetic at sa mga babae usually ang mga atypical symptoms. Kaya kapag mayroong mga simptomas na gano'n at diabetic, kailangan pa-consult agad sa doktor.
Alright. So thank you so much, Doc, for that answer. Anyone po from our audience and from the participants or any questions po that you may raise?
I think may question dito. Posible pong magkaroon ng angina or heart problem pag mababa po ang dugo. Okay? So, first, siguro, alamin natin kung anong ibig sabihin ng mababa pa ang dugo. Yung iba ho kasi sa atin, pag sinabi ho nilang mababa ang dugo, ang ibig nila sabihin is anemic. Okay? Mababa yung hemoglobin. O yung iba, pag sinabi nilang mababa ang dugo nila is mababa yung blood pressure. Okay? Now, ang angina, yung mga merong sakit na, kapag may angina kasi, meron na yung barabarang ugat sa puso. Kapag anemic po tayo, mas mataas talaga ang tsansa na magkaroon tayo ng simptomas ng angina. Okay? Kasi yung pula sa dugo, yun ang nagdadala ng oxygen. So kung kulang ang pula natin sa dugo, kulang din ang oxygen na natatanggap ng puso. So mas common sa kanilang, mas madali sila magkaroon ng chest pain compared sa isang taong walang anemia. Pag mababa naman din ang blood pressure, sa mga tao na biglang bumaba ang blood pressure, pwede rin ho sila magkaroon ng angina kasi kapag mababa ang blood pressure, ibig sabihin konti rin yung dumadaloy na dugo papunta sa puso natin. So magkakaroon din, may ischemia din, mas na-aggravate yung ischemia na tinatawag.
Alright. Thank you, Doc. Another question po for viewers. Doc, paano po madidistinguish ang pagkakaiba ng GERD
Okay.
signs of angina? May pagkakapareho po ba sila?
Yes, so magandang tanong. Thank you kay Raquel for that question. So, GERD o gastroesophageal reflux disease, okay, or versus angina. Now, yan ang sabi ko kanina, merong halos pagkakapareho to, okay? Yung iba, nararamdaman nila is chest heaviness, okay? Chest heaviness, banda rito sa harap, so anterior sa may sternum, okay? So, lalo na kung ang tao mayroong mga risk factors na nabanggit kanina, diabetic, mataas ang kolesterol, mataas ang blood pressure, naninigarilyo, kapag nakakaramdam ng parang GERD o yung mabigat sa harap o yung iba kahit dito sa gitna, epigastric, dito sa may sikmura, mahirap i-distinguish agad na hindi yon angina, lalo na kung may mga risk factors. Now, yung GERD, ang pwedeng mga sintomas yan, yun nga, parang maasim, nakakaramdam ng parang maasim sa may sikmura na umaakyat, kaya reflux, so umaakyat sa papuntang lalamunan. Okay, so kung ganon, baka GERD yon. Pero kailangan tignan pa din yung mga risk factors ng pasyente. Kasi kung meron siya ng mga high risk siya, kailangan i-evaluate muna na hindi talaga angina yun. Sige, meron pa atang tanong. Doc, may mga signs ba ng sakit sa puso na common lang sa babae, nangyayari kaysa sa lalaki? Now, yung mga signs and symptoms, pareho lang yan sa lalaki at babae. Pero yung na-mention ko kanina, na yung atypical symptoms, usually mas common yun sa mga diabetic at may mabigat na timbang at usually sa mga babae, usually mas common din sa kanila compared sa lalaki. Pero basically, pareho lang ang sintomas ng may sakit sa puso between lalaki at babae. So, I guess...
Okay, thank you. Another question, Doc, from our viewers. Hello, good afternoon, Doc. My auntie has chronic stable angina. Is it advisable to take aspirin with 325 milligram and celecoxib 200 milligram? And if the patient po is still in pain, is it okay to take ranolazine as
ranolazine. Okay.
ranolazine?
Okay, so thank you for that question. So yung auntie ni Sir ay merong chronic stable angina. Okay, so ibig sabihin, now yung aspirin, gamot ho yan na binibigay sa mga merong coronary artery disease ho na talaga. So kahit sa mga stable angina, binibigay ho yan. Now yung dosing, 325 milligrams, depende ho yan sa inyong doktor. Pero usually yung binibigay namin is 80 milligrams kasi baka naman, syempre ang mga lahat ng gamot, meron ho yan side effect. Baka mas tumaas ang risk na magkaroon ng bleeding or yung iba, yung sa gastric bleeding. So usually 80 milligrams, pero kailangan magpakonsulta sa kanyang doktor, okay? Kung kailangan taasan or hindi. Pero usually 80 milligrams po. Now, yung sa celecoxib, 200 milligrams, kung nagkakaroon ho siya ng chest pain dahil sa angina, hindi ho magandang ibigay yung celecoxib kasi ano ho yan. Actually, isa yan, iniiwasan yan sa mga taong merong sakit sa puso. Kasi parang kina-counteract niya o nilalabanan niya yung epekto ng aspirin pag nagbigay tayo ng celecoxib. Okay? So, I won't advise that. Mas maganda patingin ho sa doktor, si auntie niyo po. Tapos, if the patient has still pain, so I guess yung pain niya, kung angina yung pain na nararamdaman niya, yung ranolazine, binibigay po yan as additional therapy. So, kasama ho yan sa mga armamentum or mga drugs na pwedeng ibigay. Kaya lang, meron din ho yan, hindi ho basta-basta binibigay kasi meron din yung mga tinitignan na ibang factors kung pwedeng ibigay or safe ibigay. So, mas maganda ho patingin sa doktor, okay? Sa kanyang cardiologist.
Okay. Thank you, Doc Patawaran. Again, next question po. Kung nagka-COVID, tapos biglang tumaas ang BP, ano ang gagawin? Take lang ng maintenance BP if okay naman ang pulse rate and ECG result?
Kapag nagka-COVID, okay? Now, kunwari nagka-COVID at meron siyang maintenance, tumataas ang blood pressure. Now, syempre, tutuloy pa rin yung maintenance sa blood pressure. Huwag niyo hong ititigil. Now, depending kung gaano kataas ang blood pressure or ano ba, kailangan din alamin kung ano yung nagpapataas sa blood pressure. Okay? Pero wag niyo pong ititigil yung gamot sa blood pressure. Mas maganda ho is pakonsulta ho kayo sa doktor kasi pwede yung taasan ng dosing, dagdagan ng gamot para sa blood pressure. Pero kasi ini-evaluate ho yan ng doktor kung bakit kaya biglang tumaas. Pwedeng epekto pa rin siyempre ng pagkakaroon ng infection, nagre-respond lang naman yung katawan. Okay? Pero wag ititigil ho yung maintenance at mas maganda ho pakonsulta ho kayo sa doktor.
Okay, thank you, Doc. Another question po, do episodes of belching may be associated with MI?
Okay. Now, yung belching siguro parang ano yan, di ba? Dikhay ng dikhay or yung burp ng burp. Now, kasi pwede ho yung simptomas ng reflux, okay? Yung gastroesophageal reflux. Kaya lang nga po, gaya ng sabi ko kanina, if mataas ho meron siyang ibang meron siyang ibang associated symptoms besides from belching, nahirapang huminga, may mabigat sa dibdib, baka mas kailangan ho is pakonsulta sa doktor kasi baka ho angina na yon or yun nga, kung mas malala is baka papunta na sa heart attack o yung MI na tinatawag. So kung meron siyang mga ibang associated symptoms, baka kailangan magpatingin ho agad, huwag ibaliwala yung simpleng belching. Lalo na kung mataas ang risk niya, diabetic, hypertensive, naninigarilyo, tapos yun nga, may kasamang mga ibang symptoms.
Okay, thank you for answering the question po. Medyo madami po yung question natin, so proceed lang tayo. Another question, Doc, is, meron po bang nagka-cardiac arrest with a week of headache, possible COVID po ba?
Okay, so mahirap alamin kung yun lang ang history. Pero kung 1 week history of headache, possible COVID po ba ito? Siyempre, di natin totally marurule out pa din. So kailangan alamin kung ano ba ang edad ng taong ito, ano ba yung mga sakit before, hypertensive ba siya, diabetic, naiinom niya ba yung mga gamot? Kasi kung yung headache, madami hong possible mechanism din yan. Now, kung nag-cardiac arrest, biglang nawala ng malimad, madami pa rin ho. Baka naman ho na stroke. So, hindi lang naman COVID. Pero hindi pa rin natin marurule out ang COVID kasi kailangan check pa din sa kanyang mga simptomas.
Okay, Doc.
Meron pang tanong. I guess meron dito. So ano po ba ang management sa angina? Okay. Now, yung sa angina, syempre, unang-una, gaya ng sabi ko kanina, first is lifestyle. Syempre, wag natin kakalimutan yung lifestyle modification. So, kailangan, kapag tayo merong angina, syempre, patingin kayo sa doktor nyo. Tapos, pag nasabing meron kayong angina, wag natin kakalimutan yung lifestyle. Okay? So, healthy diet, regular physical activity or exercise. Tapos, syempre, yung mga gamot na binibigay ng doktor sa inyo, itutuloy nyo po. So, kapag kayo ho'y hypertensive, kailangan kontrolado ang blood pressure. Kung diabetic ho, kailangan kontrolado ang blood sugar. Kung mataas ang cholesterol, kailangan kontrolado din ang cholesterol. Now, depending ho sa mga test na paggagawa ng inyong doktor, kung may mga additional na gamot or kailangan pa hong additional na, kasi kapag usual cause ho ng angina pero hindi lahat is mga nagbabaradong ugat. Kaya yung iba naka-aspirin din ho para iwasan ng heart attack o yung mga antiplatelets na tinatawag. Pero kailangan konsulta sa doktor kasi madami hong pwedeng management for angina.
Okay, Doc. Okay, moving on with the next question po, Doc. Okay, good afternoon, Doc. Ano pong magandang ibigay sa patient in case of emergency outside hospital setting sa patient na tachycardia pero no BP appreciated? Thanks.
Ano po maganda ibigay sa patient in case of emergency outside hospital setting sa patient na tachycardia? Okay. So parang ano yan. So I guess, nawala ng malay, nag-cardiac arrest. Pero paano kaya nalaman na tachycardia kung wala siyang blood pressure? Anyway, baka ventricular fibrillation. Now, yung mga yan ho, kailangan tumawag ko kayo ng emergency response team. Okay? Tapos kung wala ho kayong blood pressure na na-appreciate, syempre kailangan make sure na hindi COVID yung pasyente kasi syempre kailangan protektahan nyo yung sarili nyo. Kung marunong ho, kaya kasama ho sa advocacy yung CPR. Okay? Tinuturo ho yan ng Philippine Heart Association. Pero ngayong time of pandemic, wag basta-basta agad mag-CPR. Kailangan protektahan din muna yung sarili nyo. So mag-wear kayo ng mask or face shield. Pati yung biktima o yung patient, kung kaya, takpan yung ng cloth or mask yung kanyang bibig bago tayo mag-CPR. Tapos tawag ko kayo agad ng pinakamalapit na emergency response team.
Okay, thank you, Doc. Last question na po siguro natin to for the segment. For emergency cases po, pwede po bang bigyan ng catapres yung patient? Biglang nagkaroon ng elevated BP as aid measure, na-take na po niya yung maintenance.
For emergency cases po, pwede po bang bigyan ng Now, depende kung gaano kataas yung blood pressure. Now, kung masyadong mataas yung blood pressure tapos may kasamang mga simptomas, sumasakit ang ulo, malabo ang paningin, siguro kaya bakit nyo ho alam yung catapres? So I guess binigay na ng doktor niya yon. So pwedeng inumin, pero mas maganda dumiretso pa rin kayo sa emergency room. Kasi kailangan pa rin i-evaluate yung pasyente kasi baka naman ho, pagkabigay nyo ng catapres, bigla naman bumaba masyado yung blood pressure. Mas maganda magpa-consulta kayo sa emergency room. Lalo na kung may mga symptoms.
Okay, so I think that's the last question. Okay po. So thank you so much, Doc Patawaran, for answering all our viewers' questions. So
Thank you.
now you all know what effects COVID-19 has on your cardiovascular health. So if you feel any discomfort, do not delay and rush to the hospital so that your ailment can be addressed immediately. So moving forward with the program, here's another video that will showcase the cardiovascular center's facility. Okay, let's move on to our second speaker. The title of our next speaker's presentation is Use Heart to Quit Smoking. So let us all welcome Dr. Angeli Leon Parato, an internal medicine in pulmonary critical care, pulmonary rehabilitation, and smoking cessation specialist. So, gentle reminder, may I request everyone to keep their audio and video off or we will be proceeding with our presentation in a while. Thank you.
Good afternoon. So I'm tasked to discuss about smoking cessation, vape, especially its effects during this pandemic and how to quit smoking. Start na. Can you hear me? Hello?
Yes, we can hear you po, but can you, may we request for video po, ma'am?
Video?
Yes.
Naka-share na.
Can't view your video po eh. We can't see you po.
Yung slides, kita na?
Yes, ma'am. Slides are visible, ma'am.
Okay. Okay na? Can you see the slides?
Yes, we can slides po. Yes po.
Okay, so I'll start the lecture. So, during this pandemic, syempre lahat tayo gusto mabuhay at ayaw magkasakit. So one of the things that we could do is to stop smoking or avoid being exposed to patients who are smokers. Smoking is both a habit and an addiction. So bakit po ba nakaka-addict ang paninigarilyo? It is because of the nicotine. Nicotine is the perfect drug because once it goes into the system, it releases chemicals in the brain, giving the release of anxiety and tension, decrease appetite, improve memory, and appetite suppression. Although mukhang maganda yung mga benefits ng nicotine and smoking, this is only short-lived. Sandali lang yung epekto nito. Once the nicotine level goes down, the brain generates cravings and the patient will develop withdrawal symptoms. This will make the patient tense, symptomatic with headaches, and craving for cigarettes. So once nag-smoke ulit yung patient, nicotine levels goes into normal, the smoker will be relaxed and thus do the cycle. However, ang di maganda dito, the more nicotine is required to produce the same effect. So smoking really helps you relax but shortens the lifespan. So may mga pasyente na sinasabi, isang beses lang naman sila naninigarilyo sa isang araw. But with only one stick, that's 15 minutes every day, 2 hours every week, 7 hours every month, and 4 days in a year, you cut your life short. And katulad nga sinabi ng ating first speaker, si Dr. Patawaran, ang paninigarilyo ay one of the most common preventable causes of morbidity and mortality. So maiiwasan ang maagang pagkamatay at pagkakaroon ng sakit. Dala nito ang mga toxins na makikita sa sigarilyo. So from the tip of the cigarette, the ash, to the cigarette butt, it is full of chemical additives that you could see in insecticides, poison, batteries, and paints. It has 4,400 compounds and 43 of which could cause cancer. So yung kadalasang tanong is, safe ba ang e-cigarettes or vaping compared to cigarettes? Although magkaiba sila, they have the same dangers. They offer addiction, nicotine, and cancer-causing chemicals. E-cigarettes is usually marketed sa mga younger people, mga teenagers, 20s to 30s. Okay, dahil sa kanilang interesting flavors like caramel macchiato or blueberry cheesecake, kaya mas naiinggan yung mga taong gumamit ng e-cigarette. However, this contains nicotine and the flavoring has chemicals that when inhaled could cause malignancy, cancer, pamamaga sa baga, at irritation. In the long run, ang mga metals na nasa e-cigarettes could accumulate in the body. E-cigarettes also has more nicotine than an actual cigarette. Okay? And it affects memory and ability to learn. So, mas nakaka-addict ito compared sa sigarilyo. Ano ba yung mga sakit na pwede makuha sa paninigarilyo? The most common will be cancer. 90% of cancer is linked to smoking, and 30% of deaths are secondary to cancer. it could happen sa buong katawan. So kahit na ini-inhale lang po yung sigarilyo, you could have cancer sa oral cavity, sa daanan ng pagkain, esophagus, urinary tract, daanan ng ihi, and even leukemia or blood malignancy. Second would be pulmonary diseases. Kaya yung mga smokers may mga chronic cough, bronchitis, increased mucus production, and emphysema, lung destruction. Ito yung tinatawag nating chronic obstructive pulmonary disease that 80% are from cigarette smoking. Dahil sa pagkasira ng baga, increase ang risk ng infection like pneumonia and viral infection. Sa mga hindi naman nagkaroon ng cancer ang diseases, katulad ng sinabing Dr. Patawaran, cardiovascular disease is also linked with smoking. 20% ng mga pasyente ay maaari magkaroon ng heart attack, sudden death, stroke, or aneurysm. At mga bara ng mga ugat sa maliliit na daanan like sa penile area, okay? So because of the full blood supply sa penile area, pwede magkaroon ng mga kalalakihan ng erectile dysfunction and impotence. Premature aging because of cell damage. Okay? So, buong katawan pwede maapektuhan sa paninigarilyo. Itong slide na to, papakita ang mga problema na pwede makuha sa paninigarilyo. So, that includes cataract, malignancy, heart disease, lung disease, and mga bara sa mga maliliit na ugat. So, I hope by this time napapaisip na kayo na tumigil sa paninigarilyo. The World Health Organization has said that smoking increases the chances of getting COVID-19. And last August 11, 2020, they updated their message that vaping and cigarette, in fact, when you get infected with COVID-19, it's associated with serious complications. Okay, so for smoking, transmitting the virus by bringing your hands to the mouth, and with vaping, it decreases or weakens the immune system. When you use the hookah or shisha, the tubings or the containers could also be infected. So for mga patients na hindi naman naninigarilyo, however exposed sa mga tao sa bahay na naninigarilyo, meron din po itong mga side effects sa mga pregnant women. Pregnant women exposed to secondhand smoking could have increased risk of abortion, low birth weight, or growth retardation. Sa mga bata naman na exposed to smoking, 2 times risk of having asthma and bronchitis, developing allergies, and risk of lung cancer. So may mga bata or matatanda na po na wala namang history ng paninigarilyo, pero dahil na-expose po ng kanilang kabataan sa mga kamag-anak, ay pwede po magkaroon ng lung cancer in the future. So the best way to prevent all the ill effects of smoking is to quit or never start smoking. So ano naman yung mga advantages ng pagtigil sa paninigarilyo? In 20 minutes, the blood pressure drops to near normal. In 24 hours, the chance of heart attack decreases. 2 weeks to 3 months, circulation improves and lung function decreases up to 30%. A year, the chance of heart attack is cut in half. And in 10 years of not smoking, the risk of dying for lung cancer is half of that of a current smoker. So the best way to stop a habit is to create a new habit. So anong gagawin kapag merong cravings or withdrawal symptoms? Katulad nga ng sinabi ko, smoking is a habit. So usually nakatime yun before kumain or when out with friends. So first is to delay the urge to smoke. Deep breathing also helps for relaxation. It also releases yung chemicals na nakukuha sa paninigarilyo when you do deep breathing exercise. Stay hydrated and distract from smoking. According to the American Heart Association, the best way to stop smoking is to educate yourself. So na-mention ko na po ito kanina, and within a year of stopping smoking, heart disease goes down by half. Next is to create a plan to quit. So you have to set a quit date within 7 days and choose a method. Cold turkey meaning talagang hindi naninigarilyo or gradual decrease to smoking until the quit date. Decide whether you need to ask for help sa inyong mga doktor, and the doctor will determine if nicotine replacement therapy or medications. Prepare on how to handle the urges and quit on your quit date. Quitting smoking is not easy, but what will help with the success is to make good habits, healthy choices, start exercises, get support, and stick with the smoking cessation program. So, pinapakita po dito yung mga medications sa pwedeng ibigay po ng mga doctors for smoking cessation. So sa taas, it's a nicotine replacement therapy. It could be given through a patch, lozenge, or gum or nasal spray. Okay, and the non-nicotine replacement therapy medications like varenicline and bupropion. Ito po ay binibigay ng mga doktor with supervision, dala po ng mga side effect nito. And yung naka-violet po, yung electronic cigarettes is actually controversial. It's only in the UK that they accepted the use of electronic cigarette for smoking cessation. Pero kung titignan nyo nga po, marami rin pong side effect ang e-cigarettes katulad ng cancer. So here sa Philippines, since unregulated ang mga available na vape and e-cigarettes, hindi po ito recommended. Okay? So the best way to quit smoking is to have a healthy lifestyle and to prevent heart and lung disease. Thank you.
Thank you so much, Doc Parazo, for that lecture. So, for the smokers out there, hope you will consider putting an end to your habit for the sake of your heart. So, our question and answer portion regarding Dr. Parazo's discussion is now open. You may now start to type your questions down on the chat box. Also, gentle reminder for our viewers to put your mic on mute. So, for the viewers po, do we have any questions regarding the presentation presented to us? So we're still waiting for the questions po that you'd like to address to Doc Parazo. Now is the time. Any questions po so that we may proceed with our program? Okay, so a question from one of our viewers, Doc. Is there a foolproof way to convince a patient to quit smoking?
Thank you for the question. Wala pong foolproof way to convince a patient to smoke. Kasi first of all, dapat the patient should be ready to stop smoking. Sabi ko nga, it's both a habit and an addiction. Sa addiction, you could give medications, but sa habit, it's more of psychological. So the patient should be prepared. Preparation is yung pinaka-importante kasi it's behavioral.
Yes, Doc.
Ready yung patient mag-stop manigarilyo, kahit na anong convince po natin, hindi po natin matutulog. So, kailangan po is i-educate po yung mga pasyente na naninigarilyo to be aware of the complications of smoking, and then from there, they should think about smoking cessation.
Okay, the participant who asked the question says thank you po, Doc, for answering her question. And we also received one question from the group here. So, ano po yung mga ways na possible mabawasan po yung intake ng nicotine or yung pagsasmoke ng mga patients?
Okay. So, first, meron tayong smoking cessation clinic to assess gaano ba kadami yung intake ng patient ng nicotine.
Mm-mm.
So, meron tayong mga either nicotine replacement therapy, although mahirap siyang hanapin dito sa Pilipinas.
Mm-mm.
The two available medications sa Philippines is the varenicline and the propion. So, that
Yes.
is given with prescription by a doctor. So,
Mm-mm.
in-assess muna namin kung pwedeng ibigay yun sa pasyente dahil may mga side effect. And ang ginagawa ng gamot na yon is binabawasan ang mga cravings at ang addiction ng pasyente.
Okay. Thank you, Doc, for answering the question. So I guess if we won't be receiving any questions from the viewers, here, meron pa pong humabol. Okay, Doc, does the FDA here in the Philippines have regulated yet any e-cigarettes like in other foreign countries? If so, can we consider e-cigarettes as one of the replacement choices if regulated?
Yeah, that's a good question. So,
Mm-mm.
no, FDA did not approve any e-cigarettes in the market, not unlike other countries. So, dito ang daming brands na hindi
Yes.
kita yung mga safety profile ng mga yon. Okay?
Mm-mm.
Now, hindi rin recommend ng Philippine College of Chest Physicians or the Society of Pulmonologists ng e-cigarettes kasi hindi lesser evil ang vaping or e-cigarettes. Kasi nga, mas bata yung nakikita namin nagkakaroon ng cancer sa oral cavity. Ibig sabihin nun, mga nose, nasopharyngeal cancers, throat cancers from vaping or e-cigarettes. So, hindi siya lesser evil. The best way to stop smoking, syempre, is to avoid rin the complications of smoking. So, I don't think it will be recommended in the Philippines.
As a replacement. Okay, yes, Doc. Thank you po for answering the question. So another question po from our audience. Doc, what's your opinion on nicotine-free vaping?
Okay. So, for those, may mga nicotine na free nicotine vape, sabihin nun, flavor lang. So, gusto lang nila yung malasahan, yung chemicals na yun, no? So, as mentioned in the lecture, kahit na wala itong nicotine, yung mga chemicals na ito ay nade-deposit sa baga. At pwede magkaroon ng irritation at pamamaga. Okay? So, pwede yun mag-lead sa tinatawag namin vape-associated lung injury o pagkasira ng baka. Hindi katulad ng pagkagarilyo na even up to 10 to 20 years, doon mo pala makikita yung pagkasira. With vaping, since marami nga itong chemicals and metals na pwede maniposit sa baga, mas maaga namin nakikita yung mga sakit na nakukuha sa e-cigarettes and vape. So, I think my recommendation pa din is to avoid any inhalational chemicals, no? That includes yung mga shisha, vape, e-cigarettes.
Okay, Doc. Thank you po for answering the question. It's very informative. So, thank you for the participants who asked or raised their questions on the chat box. So, for other queries, you may visit Dr. Perez's clinic here in the Medical City, Clark. Okay, I think may humabol pa po na isang question. I think this will be the last na. Doc, may case na po ng namatay due to vaping here in the Philippines?
Yes.
Mm.
So, bata lang yung patient. Okay. 23 years old yung patient who wala siyang ibang sakit kundi nagbe-vape lang siya. So, gamit niya yun for recreation. Di ba, uso ngayon sa mga bata yung videos ng vape na gumagawa sila ng shapes, gano'n.
So, yes.
So, masyado mataas yung intake niya ng vape. And the patient died in lung center for vape-related lung injury. So, namaga yung lungs niya ay nagkaroon ng secondary bacterial infection na intubated. Hindi lang kasi siya masyado nakakuha ng media attention kasi ang focus natin ngayon is more of the COVID infection.
Yes.
But vaping and cigarettes could also increase the risk of COVID infection. So it's better to avoid this.
Okay, thank you po, Doc, for answering the questions. Ihabol na po siguro natin yung last na nag-chat Does secondhand smoking applicable po sa e-cigarettes?
Good question, yeah. So,
Mm.
e-cigarette, especially if you're in a enclosed space, no? So, yung mga, dito kasi sa Philippines, hindi pa masyadong regulated ang e-cigarette. So, makikita nyo na sa paligid, pwedeng may nagbe-vape. Di katulad sa sigarilyo, talagang pinagbabawal. Okay? So, pwede pa rin kasi ma-inhale yung mga particles na yun sa mga tao nakapaligid. And although I did not mention in my lecture, meron tayong tinatawag na third-hand smoking. Ibig sabihin ng third-hand smoking, yung mga particles na dinescribe ko nga kanina, pwede siyang dumikit sa mga damit, carpet, or kurtina ng bahay at pwede rin po yun tumagal at ma-inhale ng mga bata. So that's what we call the third-hand smoking. So kahit na wala kang nakikitang usok, pwede ka pa na-expose sa mga chemicals na ito.
Okay, thank you so much, Doc, for answering the question. I think that's our last question na po from our viewers. So, just a gentle reminder for our participants. So, if you have any further questions, you may visit Dr. Parazo on her clinic here at the Medical City Clark. That is Monday, 10 a.m. to 12 noon. Tuesday and Friday by appointment lang po strictly, and Wednesday and Saturday, that's 2 p.m. to 5 p.m. Correct me if I'm wrong, Doc, is that your schedule here in TMC?
Yes.
Okay, sige po. So that's it for our question and answer portion for your presentation. Thank you so much, Dr. Parazo, for attending to our guest. Do you have anything to say to our participants?
Quit
Okay. That's a good reminder, Doc. Thank you so much po. So, moving on, did you know that the Medical City Clark offers Z packages for coronary artery bypass graft, or what we call the cabbage? You may watch this short clip for further information. All right. So this webinar is empowered by Eastern Communication. Thank you for your usual support. So moving on with our next topic, I have our third speaker here. Her lineup is entitled Use Heart to Eat and Drink Healthy. Let us all welcome Miss Gemily Mangosan, one of our Medical City Clark's clinical nutritionist dietitian.
Good afternoon po sa ating lahat. I am Jem po. Ako po yung dietitian ng Diabetes and Nutrition Management Service Center dito po sa The Medical City Clark. And ang topic po natin ngayon is use heart to eat and drink healthy. Sa pagpili ng mga kakain or iinumin man lang, ay gamitin po sana natin yung puso or yung knowledge, yung compassion, and care po. Huwag po palagi yung mga panlasa lamang. Yan. Ang layunin po ng ating topic ngayon, at the end of this short discussion po natin, sana po ma-identify niyo yung healthy food swaps na maganda para sa ating puso. Ma-describe po kung ano yung heart-healthy meals using yung DASH diet. Marami pong mga diet, healthy diet na pwede natin gamitin, pero yung DASH diet po, ito po yung pinaka-the best na diet para mapangalagaan po natin yung ating puso. So, yung DASH diet stands for Dietary Approach to Stop Hypertension. Ito pong DASH diet na to, based sa studies, it decreases cardiovascular diseases, control po yung hypertension, and pwede pong ma-prevent yung hypertension if wala pa kayong hypertension, prevent diabetes, decrease osteoporosis, and even cancer po. Pero yung DASH diet po na to, hindi po siya applicable or prescribed for patients with chronic kidney diseases and for patients na may dietary restriction of potassium. Kasi po, yung diet na to is rich in potassium and other minerals na hindi po siya applicable for mga may kidney problem. Okay, tingnan po natin kung ano yung dietary pattern po ng DASH diet na to. So, yung una po dito sa right picture natin, high in whole grains. So, ano po yung mga whole grains na yan? Wheat, oats, corn, and rice. Because they contain high fibers, and then since hindi siya processed masyado, intact pa rin yung mga vitamins nila. And next po, itong diet is rich in vegetables and fruits. Yung serving sizes, serving per day po niya is 4 servings for vegetables and 4 servings for fruits. Itong mga fruits po, very high in potassium po. And this potassium, they lower blood pressure by eliminating excess sodium po sa katawan natin. And also, rich in fiber po and antioxidant that may protect our cells from harmful toxins. Magnesium din po. Very high in magnesium yung mga vegetables like yung okra, like itong mga nasa pictures po. And also, magnesium reduces blood pressure. Yan. Next po is yung lean meat and poultry fish po yung recommendation para dito sa diet. Isang recommendation po dito sa diet is lean meat, poultry, and fishes. Ito yung medyo challenging lang dito sa diet kasi less than 2 servings per day lang po siya. And recommendation din po is more on white meats, which is poultry and fishes lang po. And prior to cooking, tatanggalin po natin yung balat. And then if you choose red meat po, piliin po natin yung mga leanest part from sirloin or yung loin part. And then kapag lulutuin natin sila, less oil po sana. Yung way of cooking, grill, bake, steam, tinola natin. Tinola. Less po yung paglalagay ng mga mantika. And no to processed meat as much as possible po. Like tocino, kasi may mga preservatives sila, like yung asin nga po na, and red fishes. And then next picture po is, ang recommendation din po ng diet na to, more on nuts, seeds, and dry beans. A serving of 4 to 5 servings per day, or like 1 serving per day po. It requires 4 to 5 servings of nuts, seeds, or dried beans per week. So, para 1 serving per day. These legumes po, they are rich in fiber, magnesium, phosphorus, calcium, and protein sources na rin po natin. Okay, next po na recommendation is low saturated and or low cholesterol diet. Lalo na po sa mga mataas yung cholesterol o yung gusto man lang i-control yung cholesterol, maintain normal cholesterol level nila, iwasan po natin yung mga pagkain na nasa picture nga po na to. Gumamit po tayo ng mga healthier oil like olive oil, canola oil, and there are also healthy fats coming from avocado, peanut butter po. And sa next recommendation is low-fat milk or low-fat dairy products. To attain po natin, para ma-achieve po natin recommendation, daily recommendation natin, we need 2 to 3 servings per day. Yeah, so of calcium. So yung calcium po, it maintain yung strong bones, heart and muscles pa rin. Kailangan ng katawan natin yan. And also, basic sa studies, it can protect against cancer, diabetes, and hypertension. So, example po ng low-fat dairy products or sa cheese, cottage cheese, and then there are piliin po natin or basahin po natin yung mga labels ng bibili natin. Dapat po nakalagay na low-fat or non-fat po. Then, other recommendation po less sweet and added sugar. So, recommendation niya is 0.5 serving per day or kung pwede nga po, wala na lang added sugar. So, pastries and baked products contain kasi unhealthy fats and madaming sugar equals mataas po yung calorie. So, hindi yan po yung iiwasan sana natin, especially sa mga sobra yung timbang. And then, kung gusto nyo i-maintain po yung current or healthy timbang ninyo. So, ano yung mga healthy swaps natin dyan? So, instead na mag-pastry ka, whole fruit na lang. Fruit na lang. And then, vegetables, kung pwede rin po. And then, sa mga mahilig po sa mga tea, like milk tea ngayon, may mga healthier options tayo. Gumawa na lang kayo ng smoothie nyo. We have here a example po dito sa right side. Sample po ng smoothie. So, gamitin po natin yung 1 serving of fruit and then yung mix of vegetables on your preference. And then, sana wag nang mag-add pa ng sugar or anything na sweetener. Enough na po sana yung sweetness coming from the fruit. And next po, low sodium. Yan. Bakit po low sodium? Kasi kapag sobra po yung nakain nating sodium, it holds fluid po kasi sa katawan and it raises yung blood sugar. Then, kapag patas po yung blood pressure, nadadagdagan po yung burden ng heart natin or yung trabaho ng heart natin. According po to American Heart Association, ideal po is 1,500 milligrams for adults with hypertension. Yung 1,500 milligrams na yun, katumbas niya po is less than 3/4 teaspoon ng table salt. And not more than 2,300 milligrams per day or katumbas na rin po is 1 teaspoon per day. Yan. Iwasan din po natin mostly yung mga convenient foods kasi they contain nga po a lot of sodium. Gaya po ng examples natin dito. Isang pakete lang po ng noodles na to is almost kalahati na or almost 3/4 na nung daily requirement. And also mostly po yung mga convenient foods natin, they contain added sugar, added saturated fats, and very high in calories. And also, wala po silang mostly vitamins. Yan, we have here also examples po ng mga sources ng sodium sa diet natin. Sa mga mahilig po ng mga sausawan, like toyo, patis, yan po yung liquid seasoning. Kung maaari po, tanggalin po na natin yan. Kasi makita nyo po dun sa equivalent ng sodium niya, almost sobra-sobra na po yan sa recommendation natin a day. Yan. Ayun, pwede nating pamalit doon is sa mga sausawan, vinegar, lime, or calamansi. Yun po yung pwede nating gamitin. And then sa pampalasa naman sa ating mga niluluto, sa lulutuin, sa mga ulam po natin, use po free sodium, sodium-free seasonings or fresh herbs and spices na lang po like pepper, ginger, onion, and garlic powder. Yan, susunod po is yung mga inumin o yung mga drinks po natin. Unahin po natin yung mga alcoholic beverages. So, yung alcohol po, pinapataas po yung blood pressure, pinapataas niyo rin po yung triglycerides, and alcohol poisoning po kapag napasobrahan. And it can lead po to obesity dahil po mataas po yung calories ng alcohol. Pero if you drink po, limit yung consumption or moderation po, no? For men, 2 drinks, and for women, 1 drink per day of the following. Sa mga hard drinks, 30 ml is 1 drink. Sa wine po natin is 120 ml yung isang drink. And then for beer is 12 ounces. If you don't drink naman po, do not start. And then, lalo na sa mga pregnant women and then 18 years old and below, should never drink alcohol po. Yan. Next po is yung caffeine. And caffeine containing beverages. Nandyan po yung kape, tea, and also yung mga energy drinks po. May mga caffeine din po sila. Yung caffeine po kasi it can cause palpitation that in excess hindi po rin maganda sa puso natin. Yan. To be safe, drink 1 to 2 cups of coffee or tea per day. Ayan. And kung pwede po, bawasan po natin yun. Kung kaya tanggalin po yung pag-inom ng soda, yung mga canned fruit juices, milk teas kasi very high in sugar po yung mga yan. And then, like yung mga milk teas, very high in fat po from creams. Up to healthy drinks with no added sugar. Example po natin yung smoothies po. Gumawa po kayo ng sarili yung smoothies, gamit po yung vegetables, fruits, and wag po yung, hindi rin po maganda yung puro prutas. Prutas yung i-blend, madaming prutas i-blend, hindi rin po maganda kapag sobra. 1 serving of fruit is enough, and then dagdagan nyo na lang po ng mga vegetables of your liking. And then, as much as possible po, huwag nang dagdagan ng mga sugar or anything na pampatamis. Yan. Recap lang po natin. DASH diet recommends low sodium, low saturated fats. Choose po yung whole grains. Add legumes and nuts po every day. Eat more vegetables and fruits. Less sweets and added sugar. And choose low-fat or non-fat milk and dairy products. And along with the DASH diet guidelines, we have here the TMC Wellness Plate. Ito rin po, isang guide po to for us to build our plate, a healthy and heart-worthy meal for ourselves and for our family. Ayan, sa picture na po na yan, half of our plate po sana, lagyan natin ng mga vitamins and minerals coming from vegetables po natin. The other 1/4, lean protein. Yung napag-usapan po natin kanina, lean protein. And then the other 1/4 is for our whole grains. Or, yung example nga dyan is brown rice. And on the side is 1 serving of our fruit. And then on the right portion naman po, or upper right ng picture is para sa ating beverage. Kung maaari po, more on water na lang. Huwag na yung mga sweetened beverages. Skip na po natin yung mga sweetened beverages. I have prepared here a 1-day sample menu basing on a 2,000 calorie diet. If you want to know your serving portions po, every food group, you can ask your doctor or your dietitian para sa computation. And start natin. For breakfast, 1 piece banana, 1 cup boiled brown rice, 1/2 cup munggo nilaga. And then yung way of cooking natin, less than 1/2 teaspoon ng oil, and then kung pwede po less than 1/4 teaspoon ng asin. And then yung beverage po natin, or ininumin natin, coffee or just water na lang. And yung coffee po, kapag nagkakape po kayo, less sugar po sana. Next po yung lunch. Yan, yung lunch po natin, 1 piece medium apple. And then yung ulam is tinola. So, 1 cup po ng vegetable. And then, isang pirasong chicken leg. And sana po tanggalin yung balat. And then, dagdag yung alat lang po is sana po less than 1/4 teaspoon of salt. And paired with 1 cup boiled brown rice. And then, water na lang po. Plain water. And for dinner, 1 wedge papaya, broccoli stir fry, yung ulam. 1 cup po sana yung broccoli. 1 matchbox size lean meat. 1 cup boiled brown rice. And then, tubig na rin po. Yan. Sa pagluluto po natin, less than 1/4 teaspoon po ulit yung asin. And then, 1/2 teaspoon ng mantika. Yan. Meron din pong allotment for AM and PM snack. Start po natin sa AM snack. And as sa picture po, nakita nyo, plain yogurt po sana, 1/2 tub. And 1/4 cup na boiled peanuts or anything na nuts na prefer nyo. Preferably unsalted po siya or hindi siya fried. Yan, para po yeah. And then for PM snack po, 1 piece boiled corn. Huwag na pong dagdagan ng mantikilya or sodium or asin po. And then pwede rin po sabayan nyo with milk or mas maganda before bedtime po natin inumin yung low-fat milk natin. Snacking can ruin your diet, so we tend to grab easy to go like chocolates, sweets, biscuit, but they're not filling. So napapadami yung kain natin. Sana po exchange natin yung mga high-calorie snacks natin to fruits and vegetables. And yun nga, isang example natin kanina is gumawa tayo ng mga sarili nating smoothies. Gamit yung preferred yung vegetable and then 1 serving of fruit. And then, wag na po nating dagdagan ng mga additional sugar pa. And this simple choice of eating healthy and improving your lifestyle will have a long-term benefit to your heart and rather to the heart of your family. These DASH diet guidelines that we discuss may help you, sana, to choose healthy foods and drinks, especially this pandemic. And thank you for listening once again. Thank you for using heart.
All right. Thank you so much, Miss Gemily, for sharing with us. I'm sure our audience has a lot of questions because, well, food is a favorite topic. So, to our dear viewers, you may now start raising your questions or concerns about the topic discussed by our clinical nutritionist dietitian. So, chat lang po tayo for any questions. To our viewers or to our Okay, so Ma'am Jam, are you there?
Pa.
Ay, hello po. Good afternoon, ma'am. Ma'am, we received one question from one of our participants. From Miss Nessie de Guzman, what cooking oil do you recommend for our daily use?
Preferably po yung pinaka-healthy or healthy na pero mas pasok po sa budget is like canola oil. Yan pa. Meron din po yung like sesame oil. Pwede po yun. And kung mas malaki-laki po yung budget, olive oil.
Okay. So, may nag-comment po from one of our viewers. Ang sabi niya, nakakagutom daw po yung presentation niyo, ma'am. Okay, so moving on with the next question. I believe Zero Claim sodas still contain sugary ingredients. So, how will we know the sugar content or the percentage in case like this? Thank you po.
Okay. So, sa mga zero-calorie sodas po kasi, hindi natin makikita or malalaman yung sugar content niya kasi yung basis lang po natin, di ba, is yung nutrition facts niya. So, hindi po natin makikita yung sugar content niya. Pero, hindi po natin ni-prescribe din kasi na uminom tayo ng mga sugar kasi may mga minerals din siya and other chemicals na nandun. So, preferably, wag na lang po ng zero calorie drinks po.
Okay, thank you, ma'am, for answering the question. So, I also received one question from the viewers. Di po ba ang olive oil is not intended for cooking?
Yes po, tama po. Kasi olive oil, may medyo mababa po yung smoking point niya. Lalo na po yung mga virgin olive oil, preferably sa mga dressings lang po natin sinilalagay. Pero this is a like olive oil lang na pwede naman for cooking, lalo na kapag hindi deep frying yung gagamitin. Pwede natin gamitin for sauteing and yan pa.
For pastas, yes. Okay, thank you for answering, Ma'am Jam. And then we also received another question. How about po ang coconut oil? I believe she's also trying to ask if this is recommended for daily use.
Yes po. Very controversial nga din po yung coconut oil. Pero coconut oil is an medium chain triglycerides ang tawag nila. Pwede po natin silang gamitin in moderation po.
All right, I see. Thank you, Ma'am Jem, for answering the questions. So for our participants, are there any questions pa po that you'd like to raise before we move with our program? Okay, so one question from the audience, ma'am. I know you didn't talk about this, but as a dietitian, what can you say po about keto diet and is this considered healthy?
Okay, keto diet is yun nga po para po sa mga specific patients yan, like sa mga may seizure problems ng mga patient natin. Sa mga other keto diet kasi, considered healthy pa rin siya kasi pinipiliin yung mga pipiliin pa rin mga food items doon is mga healthy. Though more on fat siya, pero healthy fats naman. Pero depende po yun sa medical condition ninyo. So, kung healthy naman po talaga yung keto diet, lalo na yung mga healthier version na keto diet. And naririnig nyo naman po kung ano yung mga keto diet na healthy or unhealthy siya. Decipher naman po natin kung healthy or unhealthy po siya.
Okay, thank you for answering the question, ma'am. So, last call po for our participants. Okay, so we received one question. What is most advisable sugar for daily use? Yung white sugar ba or yung brown sugar? And what is the difference?
In general po, walang masyadong difference yung white sugar or brown sugar. Pinaka-safe or advisable na how they use, basically wala silang masyadong difference. Or you can use honey po. Kung hinahanap niyo yung healthier version, honey po pwede natin gamitin. In moderation pa rin po. Pero for diabetic patients, probably less yung gagamitin nating honey. Kahit even honey po.
Okay.
Please natin.
All right. Noted po dun, ma'am. Thank you. And another question, ma'am. Ma'am, anong diet po ang pwede sa senior citizen kung nawawalan naman sila ng panlasa?
Po nga, no, as we age or as people age, nagdi-decrease po yung appetite. Pero kahit na nagdi-decrease po yung appetite, wag natin dagdagan like yung mga panlasa. Kasi like kapag yung patient natin or yung relative natin is may may hypertension and may other medical conditions, wag po natin dagdagan yung mga pampalasa. Yun lang, siguring gawin natin, encourage natin siyang kumain, piliin natin yung mga pagkain na favorite niya, and then yung way of cooking natin, kung mas maganda appealing sa mata ng mga ng mga senior citizen po natin.
Okay, thank you, Ma'am Jem, for answering the question. Another question from the viewers. Hello po, ask ko lang if what are your thoughts regarding intermittent fasting? Is this good for the diet?
Okay, intermittent fasting para po siyang way or hack to decrease po yung calorie intake. So, pwede po siya, intermittent fasting, okay rin naman po siya. Basta po, visit your doctor, ask pa rin po yung doctor. Any diet po na gusto nyong pasukin, ask your doctor pa rin po kung bagay sa inyo po yun. Lalo na po yung keto diet kanina.
Oh, okay. Thank you, ma'am, for answering the question. And then, for our participants po, do you have any other questions before we proceed with the program? Okay, I believe that would be the last question for Ms. Jem. Thank you so much, ma'am, for answering our viewers' question and for the presentation you provided us this afternoon. Would you like to say anything to our viewers po?
Yes po, if you have more gustong malaman po regarding sa diet or even diabetic diet, mga ganun po, or even yung kung gusto nyo lang makompute natin yung calorie needs nyo, specific to your body needs, just visit us po dito sa Diabetes Center, second floor, room 234 po. And promote ko na rin po yung
Sure, ma'am.
we promote also yung teleconsult. Just visit po yung The Medical City Clark FB page para po sa instructions.
All right. Thank you so much, Ma'am Jen. And I have to say, for the patients out there and for the general public, the MC Clark is ready to serve you because we are a safe zone for all patients. Thank you, Ma'am Jen.
Thank you.
Okay, so moving forward, for those of you who are afraid of going to the hospital for their checkups, the Medical City Clark is a safe zone for everyone. So here's what we have done to make it so. All right. Allow me to take a moment to thank Eastern Communication. They are our partner telecommunication service provider here in the Medical City Clark. We would like to thank you for providing us your excellent service. Also, just an additional information about Dr. Patawaran's clinic here in the Medical City Clark. You may visit him every Wednesdays, that is 2 to 5 p.m., and on Fridays, 10 a.m. to 12 noon. Okay, so moving on with our program. For our last speaker this afternoon, his topic is entitled Use Heart to Stay Active. So let us all welcome the Chief Physical Therapist of the Medical City Clark, Mr. Fritz Gerald Yumul.
Hi, good afternoon. I'm Fritz, your physical therapist for today. What we will be discussing is about the importance of warm up and cool down during an exercise. During this pandemic period, gyms are closed. Everyone are scared to go to the rehab. So if you will just give 5 to 10 minutes of your time, then we'll be making a good job. So what is the importance and what is exercise? Exercise is a planned and structured and repetitive for the purpose of conditioning. It also increases your physical tolerance in any activity. Plus, everyone says it improves your mental health, decreases stress level, and decreases cholesterol. So before you do an exercise, before you do your squats and jumping jacks, make sure you don't experience any chest pain, dizziness, or lightheadedness. If you experience those symptoms, consult your doctor. So before you do your exercise, you must do your warm-up. So what is warm-up? It increases your muscle temperature. It dilates your blood vessels, ensuring that they are well oxygenated. At the same time, it also increases your optimal flexibility by doing some stretching. So stretching is very controversial because others are saying you must do it during warm-ups and others are saying you must do it during cool-down. Well, the answer is it depends. You can use stretching during warm-ups, but doing it in a dynamic positions with short period of time. Later, one of our staff, Mr. Chad, will be showing some stretching done in 10 seconds, some calisthenics, and some cool-downs. So basically, stretching allows you to increase the elasticity of the muscles and its flexibility to prevent you from body pains and injuries. So after that, we will do some exercises and then we will do cool downs. So what is cool down? Basically, it decreases the build of lactic acid to prevent cramps and stiffness. It also helps you return to its pre-exercise level.
Hi everyone, I'm Chad. I'm a staff physical therapist at the Medical City Clark PMR department. I will be the one to demonstrate to you the exercise programs that we do for our cardiac rehabilitation program here at TMC PMR. So the exercise program has three main parts. First is the warm-up part, which are the stretching exercises to be done for 10 repetitions, 3 sets. And then the second part, calisthenics exercise, to be done for 16 repetitions, 3 sets. And the last part, the range of motion exercises for both upper and lower extremities, to be done for 10 repetitions, 3 sets. Neck bends. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 2. Next po is elbow crossover. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next po is stretching na trunk rotation. Squat, twist. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Balik. Up. Squat, twist. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Dancer squat stretching exercise. One leg forward. Bend the knee. Make sure that the knee at the back is straight. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Other leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next po is side trunk bending calisthenics exercise. 16 repetitions. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. Next po is arm abduction exercise. 16 repetitions as well. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. Next po, double punch exercise. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. Next po is story sitting calisthenics exercise. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. Next po is knee flexion exercise in sitting calisthenics exercise. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. Next po is leg abduction sitting calisthenics exercise. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. For the upper extremity exercises, first we have shoulder flexion exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Second, shoulder abduction exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Third, elbow flexion exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And the fourth, forearm supination and pronation exercises. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. For the lower extremity exercises, first we have hip flexion exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hip extension exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Knee flexion exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And tiptoe exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9,
So there you go. Hopefully you learned something through our webinar for today. You can do your exercises. It's either in standing or sitting position. It depends on you. If you have any symptoms, please consult your doctor. So in this pandemic, use your heart to stay active. Hi, good.
All right, thank you so much, Sir Fritz, for that wonderful presentation. I'm sure staying active with a daily dose of exercise will help strengthen our hearts. So, again, for our viewers, now is the time for your questions regarding the topic discussed by Sir Fritz. You may now start to send your queries through the chat box. Good afternoon po, Sir Fritz.
Hi, good afternoon, ma'am.
Yes po, kamusta naman po sila?
Okay lang, okay lang. Kumusta po lahat?
Okay naman po din, sir. So, okay, sir, one viewer is asking if they can have a copy of your presentation. Maybe yung sa exercises po yung pinaprint nung one of our viewers.
Pwede po kayong pumunta sa rehab, then ng copy ng mga exercises natin. So yung mga exercises natin, ma'am, as MC, hindi siya ganun ka-active like yung mga squats, mga burpees, jumping jacks. Yun po yung kasi yung mga protocols namin sa cardiac rehab, which is advisable sa mga patients, ay kahit kaninong tao, even na may arthritis ka or matanda ka, kasi hindi mo siyang gawin ng nakaupo at nakatayo. Ano lang, ma'am, punta po kayo sa rehab. Open kami Mondays to Saturdays, 8 to
Okay.
5 po.
All right. Sir, what about for our viewers or sa mga participants po natin that are located outside Pampanga? Paano po kaya sila makakakuha ng copy nung ano? Maybe even the list lang po or kung may mga visual representations then for the exercises that were featured dun sa slides po natin kanina.
I_PMR at themedicalcity.com.
Okay, sige, sige, sir. Thank you po, Sir Fritz, for answering that question. Okay, so I think this is additional question po dun sa humihingi ng copy ng presentation. So, need po ba magpa-rehab muna? So, hindi naman po ata.
If may napifeel kayong pain, ma'am, or in heart condition, pwede po mas maganda mag-consult po muna kayo.
Okay.
Sit as an in.
Okay, Sir Fritz. Thank you po for answering the question. Another question from our participant. Ask ko lang po, if with problems sa heart like cardiomegaly, is it advised to do your exercise? Thank you.
With cardiomegaly, ma'am, mas advisable pa rin po na punta kayo sa cardiologist nyo, especially for the medical clerk. Andyan po si Dr. Jeff Patawaran, then magbibigay po siya ng prescription ng mga exercises na pwede po for patients with cardiomegaly.
Okay, so let me just clarify, Sir Doc Patawaran po, you're referring to Jeffrey Patawaran, yung unang speaker po nung, okay. So remind ko lang po for our viewers, information, Doc Patawaran's schedule here in the Medical City is every Wednesdays, that's 2 to 5 p.m. And on Fridays, that's 10 a.m. to 12 noon. So, they're asking po, Sir Fritz, yung email address po again, kung saan po sila pwedeng mag-request. Can you repeat it for our participants?
It's tmci_PMR@themedicalcity.com.
Okay. Okay. Thank you, Sir Fritz, for answering the question. Again, another question po. Hello, sir. Pwede pong magawa yung mga exercises daily? I'm sorry, exercises every day.
Yes, ma'am. Advisable po nag-exercise tayo araw-araw para at least alam po ng heart natin kung kailan siya magpapump ng mabilis and mabagal. Kasi yun ang nowadays, dahil pandemic, more on nasa social media tayo, nasa Netflix, maglakad tayo to, let's say, to CR, may hingal na or even magpalik lang tayo ng stairs. So, mga exercises, piliin nyo lang po yung mga kaya mo na. Huwag yung parang sobrang bigat na para sa pakiramdam. Parang natutulungan din natin yung heart mag-compensate na mag-pump po.
Okay. Thank you, Sir Fritz. So, for our viewers, you may ask questions pa po so that ma-answer pa po ni Sir Fritz while we're still at it. Any questions from our viewers or participants?
Mukhang wala na ata, ma'am.
So, okay. Okay, so this is just a clarification, sir. Di masyadong clear. It's TMCI_PMR, I believe. Repeat ko lang po yung email address ni na Sir Fritz. Sir Fritz, correct me if I'm wrong. So that's TMCI_PMR at themedicalcity.com.
Yes, ma'am. Correct po.
Okay. So that's TMCI, that's Tango Mama Charlie India _Papa Mama Romeo at the Medical City Clark. So we will also be sending the email address sa chat box po para makuha nila yung precise spelling po ng mga audience. Okay. So, Sir Fritz, another question po. Cardiac rehab program is designed for patients with heart conditions, pre and post surgery. With your program, do you incorporate weights to promote strength and endurance, or do you do resistance-free motion exercises?
With our program, depende po yan dun sa kayang intensity ng patient. So, together with our cardiologist po na nagpa-prescribe ng mga exercises, your question po, yes, we use free weights po. We use dumbbells, pero light weights lang. Up to, pinaka-heaviest na na-encounter namin is 5 pounds po. Then we also use some resistance bands for patients for cool down po.
Okay. Thank you, Sir Fritz. Okay. A question from Sir Glenn from our participants. Yes, sir, you had the correct email address. It's a chat box. I would just like to confirm. All right. So, is there any other questions before we proceed with the program? Wala na po siguro. Anyways, if you have any inquiries, Sir Fritz, kailan po nila kayo pwedeng i-visit dito sa TMC?
Open po ang the Medical City Clark Rehab Department during Mondays to Saturdays, 8 to 5 p.m. po.
All right. Thank you so much, Sir Fritz, for giving us a very insightful presentation and answering our participants' questions po.
Thank you po.
Okay. Do you have anything to say po sa mga naging participants natin sa webinar for today?
Hello po. Ang advice ko lang po, before you reach into a certain activity like biking po, hindi po kayo masyadong gumagalaw or nag-exercise or mag-bike or mag-run kasi it can cause a lot of problems po. And if anything na may maramdaman po kayo po, is
All right. Thank you so much, Sir Fritz. Ladies and gentlemen, I would like to thank you for attending and participating with our webinar, and we hope that you will use your heart to beat cardiovascular diseases. This has been Ms. Paterica of the Medical City Clark, and I wish you all a great afternoon. Thank you so much, and God bless.